Community Promise is an HIV prevention program that was developed in response to an urgent need for effective interventions that could reasonably be implemented by local health departments and service organizations. This is a program designed to work with the most challenging populations. Community Promise is an intervention package that outlines how an agency can develop a community-based homegrown intervention that focuses on the community's self-identified needs, that is delivered by members of the community, and uses stories from the lives of local people.
I work with addicts, I work with prostitutes, I work with the homeless. Basically what I do is I give out condoms and bleach kits. I talk to people that are at risk.
I really love my work, but one of my biggest frustrations is that after I work with one person, they go back out into the same environment that put them at risk in the first place.
What we really need to do is try to change the environment out there to make things not so risky for them.
We can change lives, because that's what it's all about. You know, changing a person's life, showing them that you care.
They care for the community. If you really want to get off drugs, or off, prostitution or anything like that, they're the ones that you should count on them. You can trust them with your life.
I'm not out here Monday through Friday. I'm out here Saturday and Sundays and holidays also. I just wish I can just help more than one person, but if I get one person, I think I've done a good job.
Doctors can't tell me anything. They have a lot of book knowledge, but they haven't been out here living what I'm living.
I've gone into free clinics and stuff like that before, but they tell you should be aware and use condoms if you're high risk and stuff, but they really don't know. They don't seem to come across right, like they're sincere. It just doesn't seem to reach most people. It seems more like they're talking at you. They're just telling you what you should do, and I don't respond well to that.
I don't want anybody to tell me how to get it or what to do unless they're doing what I'm doing. Every girl's different. What they do is different. Their height is different. The people they deal with is different.
You're going to reach me if you're trying to be sincere with me, but if you're just telling me what I should do, I'm not going to respond to that very well.
The community in the name Community Promise refers to two facts. First, Community Promise is a community-level intervention. Its impact is intended to extend beyond the individuals who come in contact with the intervention into the very community they live in, so that the community as a whole will change its behavior. Second, the elements in Community Promise literally come from the community, from population members who share their true stories. We call these role model stories. These stories highlight the strength of community members to change and practice safer behaviors. The stories are distributed by peer advocates to other target population members. The intervention is intended and designed to influence a particular community of target population members, not just one by one, but by being dispersed through that population. The promise in Community Promise stands for peers reaching out and modeling intervention strategies. This is a peer-based intervention where members of the target population pass out role model stories. These stories are drawn from the real-life experience of the target population. Outreach workers also recruit target population members to become community advocates. The community advocates distribute the role model stories and other materials such as condoms or bleach kits. They reinforce their friends' and associates' use of the materials. Outreach workers visit these peer advocates in the field, providing them with materials to distribute. Experienced outreach workers are critical to this intervention and become managers of the peer advocates. Community Promise is based on the experiences of the CDC AIDS Community Demonstration Project. Role model stories were distributed, along with condoms and bleach, by community members who encouraged and reinforced behavior change. The target populations for the intervention were injection drug users, their female sex partners, sex workers, non-gay identified men who have sex with men, high-risk youth, and residents of areas with high sexually transmitted disease rates. In a 3-year study conducted in 5 cities nationwide, Long Beach, California, Seattle, Washington, Denver, Colorado, Dallas, Texas, and New York City, New York, this intervention was evaluated to examine if this community-level intervention was effective in promoting progress towards consistent condom and bleach use. The study found movement towards consistent condom use with main partners at the community level, as well as increased condom carrying in cities that received the intervention. Therefore, this intervention can lead to significant community-wide progress toward consistent HIV risk reduction. There are 4 components of community promise. The first is a preliminary community assessment. The community assessment is a process by which an agency really reaches out into the community to figure out what the community needs and is open to. A critical first step in any HIV prevention program is becoming familiar with the target population. A program will be effective only if it's tailored to the specific population whose behavior is being addressed. This requires understanding the practices that put that population at risk, the meaning of those practices to population members, and the context in which the risk behavior occurs.
This intervention is about working with the community and actually talking to them to see what their needs are and to go out and build your intervention around the needs of the community.
We don't just come in with everything having been preset. We listen to their needs, and that's what we base our intervention on, and that's really why it works.
The message that's sent to the people comes from the people. It's the people are telling us what their needs are, and in their own words, what they can do to change their behaviors, what's realistic for them to change.
The second component of community promise is the role model story. From the interviews conducted with target population members, role model stories are produced. The role model stories are produced as small print materials that can be distributed to large target member populations by peer advocates.
My name is Candy, 33. I'm originally from Salinas, California. I have 11 kids. I just had my 11th one 2 weeks ago. I'm homeless. I live in a garage. And I've only been doing heroin for 7 years, still using. That's about it.
The primary purpose of role model stories is to model a risk-reducing behavior, suggest solutions to risky situations, and to illustrate positive outcomes of taking steps towards self-protection.
These are real people that we've had interactions with, and it's talking about their real lives and things that they've done in their lives, how they've overcame and changed their behaviors to reduce their own risks. You need someone who's been there and understands what's really going on out here on the streets.
Yeah, these stories really make you think. They make me think anyway about using condom. I think about what if he says no, but these stories really put something on my mind, and I would have to turn them down.
I like the booklets because I'm always wondering who's going to come in next. I've had a couple stories sent to myself, and it's always going to be one of us, not somebody we don't know. So it makes it more interesting to read.
Material is really important. It has helped me a lot because I'm able to tell somebody else about that. I'm not afraid to use the condom.
The third component of community promise is the distribution of materials by peer advocates. The success of this intervention lies in the focused and frequent distribution of specific types of HIV prevention materials to members of the target population. The peer advocates are responsible for getting the role model stories into the community. Not only do advocates distribute the role model stories to a specific target audience, but they also interact with target population members to encourage the adoption of risk reduction practices and to provide social reinforcement for behavior change.
When I go out on the streets, a lot of the prostitutes now come up to me and ask me for condoms. Because of the stories and because of the information that we've given them and the counseling, they realize that it is very, very important for them to use condoms. After working for a couple of years out on the streets, I've seen hope. I've seen hope in their faces.
You know, we use volunteers or peer advocates. And the peer advocates are great because, you know what, I work 8 to 5. I go home at night. They're there when I'm not, shooting galleries, crack houses. So, they're really more effective in reaching the people when the risk's going on.
The places I go to is where I was born and raised around. Any other person couldn't go. So when I go in there, it's like I'm at home. They all know who I am already.
So if they're out there interacting with them or giving out condoms to them right at the time of risk, they're more likely to be able to, that somebody's going to use the condoms, use the bleach, and to protect themselves. Plus, they're going to have more influence on their friends than I'm going to. I used to be out there doing what they're doing, but I'm not anymore.
I think this program has helped a lot of people. The drug addicts sitting on the streets and the women walking the streets can change their lives, but they need more program and they need people like us to get out there and give them that hope.
The last component of community promise is the evaluation. There are many levels of evaluation, and the manual instructs you on how to conduct each one. Community Promise is a proven and effective intervention. This is an intervention that is relevant and acceptable to community members because it comes from the community and uses the community's own stories to foster behavior change. The intervention package will guide your agency in developing this intervention for use in your community. The intervention package contains how-to manuals and examples that guide its implementation. For further information or to obtain the Community Promise package, please contact the Centers for Disease Control or visit the Community Promise website.